Do you have a surgical procedure coming up? Are you nervous about it? In this video, I'm going to talk you through exactly what's going to happen on the day of surgery, step by step, and really help demystify the process to help with your nerves before surgery. My name is Dr. Saib Geller. I'm a plastic and reconstructive surgeon based here in Miami, Florida. If you find this video useful, please like and subscribe. Okay, so if it's your first surgery, or if it's any surgery at all, really, it's totally understandable that you will have nerves. And we always say to our patients, that's how we know you're normal. You don't do this every day. It's a strange situation. Things are taken out of your control. So it's absolutely 100% normal to have nerves. So what to expect? So typically, and I'm going to talk through what usually happens in my practice, but it's, throughout the United States anyway, this is pretty much the status quo for when you're having surgery, whether it be in a hospital or a surgery center. If you're doing it in a hospital, usually the process is a little bit slower, because there's usually more kind of administrative barriers as you go along. But in general, this is the flow of things. So typically, you'll arrive first thing in the morning. It may be very early because us as surgeons, we usually start, 7, 8 o'clock in the morning in the operating room. So that necessitates the patient usually being there 1 to 2 hours beforehand. So it can be a really early start. So first thing you're going to do when you get there is get checked in. And usually it's registration. You'll usually get a wristband at that point, just making sure all the paperwork's correct. We're going to check your ID, your insurance information, all that sort of thing. You'll probably have to sign a bunch of papers at that point. There may be a little bit of waiting, and then you'll be brought back to the pre-op area. So typically what we're doing in the pre-op area is verifying again your paperwork, verifying your medical information. We're going to change into a surgical gown. Usually you'll get a hat to match the rest of us, a nice bouffant hat for the operating room, and typically a pair of socks and maybe some squeezers or compression tights as well, depending on the location and the procedure. And so usually the only procedure we'll do to you while you're awake is typically we'll do the IV line. And so that's very quick and easy. Most commonly, it's just like a blood draw. And one thing I think a lot of patients get hung up on is they think the needle is going to be left in there, and that's not the case at all. The needle is just used to introduce this tiny little plastic cannula, which is going to deliver the medications, and then the needle is gone, it goes away. So it only pinches while it's going in, just like a blood draw, and then you won't feel it at all. And usually we'll start you on some fluids as well, because you'll have had nothing to eat or drink from midnight the night before. Next, in most cases, you'll get to meet your anesthesiologist. And so typically they will have a list of questions they'll want to verify with you. They may look at your head and neck, listen to your heart and lungs, and do a quick medical exam, just all for safety's purpose. And the purpose of the anesthesiologist or the nurse anesthetist is they're going to be 100% focused during the case in taking care of you. So they're never going to leave your side during the surgery. And so while your surgeon is focusing on the surgical aspect, they're going to be monitoring your heart, your lungs, your vital signs, your pain, signs that you've got pain, that sort of thing, in order to keep you as safe as possible. And so at that point, when you're meeting your anesthesiologist, it's a good time to mention if you've had problems with anesthesia in the past. Have you ever had nausea and vomiting afterwards? Because there are specific things you can do to prevent that. And on that, over the past few years, post-operative nausea and vomiting has become a huge focus for anesthesiologists, and they've gotten really good at preventing it. So there's lots of different things that can be done in order to avoid that. And so then typically the next person you'll see is me, or your surgeon, and usually what we'll do is just chat, review the plan, maybe review your medical history, make sure nothing has changed since we chatted last. And typically, especially if you're having plastic surgery, we're going to do some drawing wherever we're going to operate, and or we're going to mark the side. If you've got one arm that needs a surgery, we'll mark the correct side and verify that. And then shortly after that, or it could be a while, depending on how the day is going, you will go back to the operating room. And so in hospitals, usually you'll get wheeled back to the operating room. In surgery centers, oftentimes you'll walk with your nurse back to the operating room, and then either get up onto the bed or transfer over to the bed from your stretcher. And that's the last job of the day we're going to have you do. After that, it's time for a nap. And most patients will agree that the anesthesia nap is a really good one. Again, anesthesia has gotten so sophisticated over the past few years. Most patients agree it's a really pleasant process. So when you get back into the operating room, you're really not going to remember much, because typically your anesthesiologist will sneak you something to calm you down at that point. And for a lot of patients, that makes them forget things. But what's happening when you get back to the operating room is the staff in the operating room are kind of doing, like what one of my patients described as, it's almost like doing a pit stop. So we're going to make sure you're secure on the bed, make sure you're comfortable, your pressure points are padded, that you have squeeze-you boots or sequential compression devices on your legs, which massage your legs while you're asleep and prevent blood clots. They're going to make sure you're warm, probably put a warming blanket on you as well, and make sure everything is safe and set up for the surgery. Now, when you're actually falling asleep, you're not going to be conscious. You're going to be long out before the breathing tube is put in, if your anesthesiologist is going to put a breathing tube in, and they'll discuss that with you before the surgery. So you will not be aware of anything like that happening. You'll just drift off to a really comfortable sleep, and then like that, you're going to lose time and you're going to be in the recovery room. And if you guys find this useful, I'll do another video of what to expect once you're back in the recovery room.